Hello, my dear friends. Hello, everyone. Yes, the question have been started and the answer also are there. Yes. BNS for McNaughton rule is which BNS? Very, very important. BNS for McNaughton rule is, yes, this is a very, very important session of forensic medicine. I try to enumerate 50 MCQs, which are very important for your examination point of view. Yes. BNS section for McNaughton rule is 22. Yes. For any protection of insane, if insane commits the crime, the BNS section would be 22M. Yes, 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 yes. You made the trick also. That is a very important trick. It is criminal responsibility of insane. Yes, my dear friend, it is 22 BNS. Criminal responsibility of insane, it is 22 BNS. And I told you the trick, you become naughty at 22 because once you clear the age of marriage in India, what is the age of marriage for male in India? That is 21. And you become naughty at the age of 22. That is a trick to remember. Yes, that is the trick to remember. BNS section for protection of mentally ill person and insane is 22 BNS. Okay, absolutely right. Second question, a police recovers the bee-headed skull bone. Yes, very, very important one. That is a bee-headed skull bone. And there is a, yes, and relative of a missing person gives the photograph of missing person to the police. So it means we are matching the skull to the photograph. This two sample can be analyzed by which technique? This question has been frequently asked. The answer is superimposition technique. Yes. What are the remaining options? Fingerprint is the best method for identification of criminal. DNA fingerprint or DNA analysis is the best method for decomposed body. And chilioscopy is the study of lip print. Yes, without any doubt, the best method for criminal identification is fingerprint. The best method for decomposed is dead body is DNA fingerprint. The lip print identification is known as chilioscopy. So I mentioned other option also in detail so that you can correct all the things. Now, the next question. In corrosive acid case, stomach is opened from which side? Give me the answer. Pylorus part, fundus part, lesser curvature and greater curvature. Poroscopy, Dr. Gautam Raj Gupta, poroscopy, the study of pore. Study of pore. Okay. So here, without any doubt, the answer is greater curvature. Okay. Now I'll discuss the other dissection also. The brain dissection, my dear friend. Brain is dissected with 10% formalin, my dear friend. Brain is dissected with 10% formalin. And here incision 1 centimeter are given in coronal section. This question comes in exam. Incision given in coronal section. Yes. Now the heart dissection, if you see, it starts from right atrium, right ventricle, left atrium, left ventricle. It starts with right atrium, right ventricle, left atrium, left ventricle. You can remember by a trick, the heart is on the left side little bit, but whatever heart speak, that is right. हमारा दिल है ना थोड़ा लेफ्ट साइड में होता है लेकिन बात हमेशा राइट करता है. That is a trick to remember. That is the trick to remember. Right atrium, right ventricle, left atrium, left ventricle. This is a heart dissection technique. Okay. So I have discussed two dissection technique. Now the third one, spinal cord. The best method to dissect the spinal cord is posterior technique. And stomach, as I told you, it is a double ligature method. Stomach is dissected by double ligature method. And I'll start the dissection from greater curvature. I'll start the dissection from greater curvature. So I mentioned all the important organ to be dissected. है ना, मैंने सारे organ को dissect कर लिया कि कैसे करना है. Brain is done, heart is done. Heart is on the left side. You will start from the right side. Spinal cord from posterior side, and stomach dissection you will start from greater curvature. है ना? Done, sir? Is it clear? चलो आगे, है ना? Okay. Okay. Yes. Everyone is yes, absolutely right. A surgeon performs the hysterectomy for uterine fibroids and obtaining relevant informed consent from the patient. Despite adequate precaution, the ureter was injured. Actually, sir, he has taken all the adequate precaution, but still the ureter got injured. What is this? Anyone who can tell me? The doctor is not responsible under which condition? Yes, it is medical maloccurrence. Doctor is not responsible under medical maloccurrence because he has taken all the due care. तो दोस्तों अगर आप पूरा केयर करते हो, there is a some injury, some damage, that is known as medical maloccurrence. I'll discuss all the remaining option also. So what is medical maloccurrence? It is very simple. You have taken all the care, but still there is an unfortunate event or outcome. You have taken all the care, but still there is an unfortunate event or outcome. That is a medical maloccurrence. अब आपने पूरा care किया, but still there was a unfortunate event or outcome. This is medical maloccurrence, my dear friend. It is a defense for a doctor. It is a defense for a doctor. Now, sir, very, very important word, novus actus interveniens. This is a very important word, option A, novus actus interveniens. What is this? This is new intervening act or event that break the chain of causation and relieves the original party for responsibility. है ना दोस्तों, new action intervening. I am giving example. There is a road traffic accident. है ना, किसी का road traffic accident हो गया. And after this, the doctor had a fluid, doctor caused a fluid overload, and a doctor ने fluid दिया, and the death was due to fluid overload. So this is a new action. What is a new action? The new action is the fluid overload which is created by doctor. So here, the responsible party will become a doctor. This is novus actus interveniens. So आपको ये भी मालूम होना चाहिए what is novus actus interveniens. It is a new action intervening the cause of death. Or you can see that it relieves the original party of responsibility. बेटा ये समझ में आ गया? It is a new action intervening the case that relieves the original party of responsibility. This is known as novus. Okay, sir, can you tell me what next to? I'll tell you, don't worry. This is novus actus interveniens. So be careful, sir. New action intervening the causation or the chain or break the event. This is known as novus actus interveniens. Now, sir, res ipsa loquitur. What is res ipsa loquitur? The thing or fact which speaks for itself. What is res ipsa loquitur? The thing or fact which speaks for itself. What is this? I'm giving a very simple example. Doctor forgot the swab in the body, or doctor forgot any instrument in the body that caused the death. This is known as res ipsa loquitur. So this is sufficient to prove the negligence of a doctor. This is known as res ipsa loquitur because the instrument in the body is the thing which speaks for itself. ये बताती है कि डॉक्टर से negligence हुआ था. That is known as res ipsa loquitur. So I'm explaining every option so that you can get everything in your mind. है ना? Now identify the type of abuse shown in the image. Anyone? Begging, snorting, sniffing, huffing. Tell me, dear. Yes. What is this? Identifying the type of abuse in the shown in the image. Yes, it is begging because the person is using a bag to inhale something. The person is using a plastic bag to inhale something. This is known as begging. What is snorting? Snorting, you are inhaling by any nasal inhalation. Yes. Sniffing, if you are using any container. But what is huffing? Huffing is for inhalation if you are using a cloth. Doctor, you can remember by trick. H for huffing, H for handkerchief. So if you are using handkerchief for inhalation, that is known as huffing. Snorting is nasal inhalation, begging is plastic bag, sniffing is container, and huffing is you are using cloth piece. Is it clear, beta? Okay? है ना? बिल्कुल एक एक चीज को एक एक ऑप्शन को भी अपने को रूल आउट करना बेटा. Yes, wonderful. Sir, ballooning is if you are using balloon. What is glading? Doctor, if you spray in the room, then you inhale. If you spray in the room, then you inhale. It is known as glading. Doctor, what I do? Like if I am in a room, I spray everywhere and then I inhale. Ha 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 ha. I feel very, very glad. That is a glading. If you spray in the room and you feel very glad, that would be glading. Is it clear, beta? Ballooning is by balloon, huffing is by cloth piece. है ना? कैसे याद करोगे? आपने कमरे में स्प्रे किया, आपने इनहेल किया, and you feel very, very glad, that would be glading. चलो आगे. Very good. Sir, the Blackfoot disease and peripheral neuropathy seen in which metallic poisoning? There's a Blackfoot disease and peripheral neuropathy in which metal poisoning? I suspect this is a very important question. Anyone who can give me the answer? It is arsenic poisoning. It is none other than arsenic poisoning. You can see some feature of the arsenic poisoning. The first question, in arsenic poisoning, the sensory neuropathy is more common than motor neuropathy, and it resembles GBS, Guillain-Barré syndrome. So this is a very important point. Sensory is more common than motor neuropathy, and it causes peripheral gangrene. That is a Blackfoot disease. It causes a peripheral gangrene. That is a Blackfoot disease. And the malignancy by arsenic more commonly squamous cell carcinoma than basal cell carcinoma. So this is a very important MCQ. I would say sensory neuropathy is more common than motor. Blackfoot disease is there, and squamous cell carcinoma is more common than basal cell carcinoma. That is a arsenic poisoning. Yes, this is another very important question. There was a snake bite history. There is a headache, blood vision, tingling sensation around the mouth. That means it's a neurological symptom. Dizziness, vertigo, had a multiple episode of vomiting since the bite. And there is a sign of respiratory distress and bradycardia. दोस्तों दोनों पॉइंट पे concentrate करना. There is a sign of respiratory depression and bradycardia that indicate that this particular snake poisoning causes respiratory muscle paralysis. Yes. There are no apparent bleeding manifestations. So there is no bleeding manifestation. That means viper is ruled out beta because viper causes bleeding. He was administered 10 vials of antivenom. Which of the following subsequent step has to be taken? Doctor, probably yes, everyone is absolutely right. It is a cobra bite. So in cobra bite, we will go for neostigmine with atropine. In cobra bite, we will go for neostigmine and atropine. And डॉक्टर साहब ऐसे ध्यान भी रख लेना, there is another trick. Cobra is a नाग. Cobra को क्या बोलते हैं? नाग. So N for nag, N for neostigmine, A for atropine, and G for given. In nag, neostigmine and atropine is given. What is the trick? N for neostigmine, A for atropine, G for given. That is nag bite. That is a cobra bite. है ना? ट्रिक अच्छा लगा ना? बिल्कुल इजी है ना? In nag or cobra bite, it is given. Okay, we'll discuss some. है ना? एकदम समझ में आ गया बेटा? In nag, neostigmine and atropine is given. Yes, beautifully done. Sir, neostigmine act on the postsynaptic cleft where the cobra bite or LAPD act beta. And also cobra bite also act on the postsynaptic. And to counteract the side effect of neostigmine, we give atropine. To counteract the side effect of neostigmine, we give atropine. Now, sir, these are the treatment. Anti-snake venom, neostigmine, atropine, and mechanical ventilation are done in cobra bite. Yes. V for viper, V for vasculotoxic, because viper is a vasculotoxic. Okay. So here what we give? Anti-snake venom. Yes. Fresh frozen plasma. Now you must be thinking, sir, why do we give fresh frozen plasma? We give fresh frozen plasma to counteract the bleeding because viper causes bleeding, and surgical debridement because of viper causes necrosis and gangrene. We go for this treatment in the viper. Yes. Yes, wait, beta. I'm coming to the karet. है ना? बच्चे ने पूछा, गौतम राज गुप्ता ने पूछा, what about the karet? Sir, karet we don't give neostigmine and atropine because karet act at the presynaptic side. Cobra act on the postsynaptic side. Karet act on the presynaptic side. That's why no need to give neostigmine and atropine. Here we give anti-snake venom and mechanical ventilation itself. Okay, beta. Did you get the point? Cobra attack on the postsynaptic side. We give neostigmine plus atropine, but karet doesn't act on the postsynaptic side. It acts on the presynaptic side. That's why we don't give neostigmine and atropine. We give only ASV, that is anti-snake venom and mechanical ventilation. Is it clear to everyone, beta? क्योंकि देखो दोस्तों, ये तो मैंने कोबरा बाइट का पूछ लिया, but if they are asking about the viper bite and karet bite, we have to be very much ready, my dear friend. Is it clear? You can get this question in your exam, that what is the right strategy for snake bite? What is the right strategy for snake bite, beta? You can see R for reassure the patient, I for immobilize the patient, G for go to hospital as soon as possible, GH, and give the proper history to the doctor, tell the symptom and start the treatment. This is the right strategy for snake bite. Again, I'm revising, my dear friend. What is this? R for reassure the patient, I for immobilize, GH for go to hospital, H for tell the proper history, tell the symptom, and T for treatment has to be started. That is a beauty. It is a very important question, comes in exam. What will be the treatment protocol of the snake bite? Yes, absolutely right. Everyone is getting benefit from these classes. Which of the following dental notation system is as shown in the image? Anyone who can give me the answer? Option A is a Palmer notation. Option B is a Hadrup system. Option C is universal numbering system. And option D is Federation Dental International. Sir, it is Palmer notation. I'm expecting this question in your exam because they can ask you the dental formula. Okay. Now, sir, what is Palmer notation? I'll come first dental formula, Palmer notation. What is Palmer notation? It is also known as Zygmundi method. Palmer notation is a Zygmundi method. Here we are dividing the dental formula in 4 quadrants. That is right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. That is a Palmer notation. Okay. And here the number of teeth are written 1 to 8. Here number of teeth are written 1 to 8. Okay. So this is the question. As you can see, the teeth are written 1 to 8, 1 to 8, 1 to 8, and 1 to 8. This is Palmer notation. So this is Palmer notation or Zygmundi method. Here teeth are written. What is the number? Here teeth are written 1 to 8. For temporary teeth, absolutely right. For temporary teeth, it is not 1 to 8, it is A to E. Yes, absolutely right. A permanent teeth, it is 1 to 8. For temporary teeth, we don't write down the number, we write down the letter, that is A to E. Okay. But sir, if I use for upper teeth, I use plus symbol, and for lower teeth, I use minus symbol. So along with upper teeth, I use plus, and along with lower teeth, I use minus. That will be a head-up dental system. So if plus 1 to plus 8 and minus 1 to minus 8 are written, that will be a head-up charting. That would be a head-up charting. Okay. If the plus and minus symbol are given, that would be a head-up charting. Now, sir, if the teeth are written 1 to 32, that I'm coming to a very, very important point. If the teeth are written 1 to 32, that will be a universal or Cunningham method. If the teeth are written 1 to 32 in number, that would be a universal or Cunningham method. Here the number of teeth are written 1 to 32. Okay. Now, sir, this is universal or Cunningham. Third method is done. Now, sir, the number 4 charting FDI. Yes. What is FDI? थोड़ा ध्यान से देखना बेटा. FDI is Federation Dental International. It is Federation Dental International. Here what I do, I divide the teeth in 1 number quadrant, 2nd number quadrant, 3rd number quadrant, and 4th number quadrant. So I divided the teeth 1 number quadrant, 2nd number quadrant, 3rd number quadrant, 4th number quadrant. Okay. Now in the teeth, I will add in 1st quadrant, I will add 1, 1, 1 to 1, 8. In 2nd quadrant, I will add 2, 2, 1 to 2, 8. In 3rd quadrant, I will add 3, 3, 1 to 3, 8. And in 4th quadrant, I will add 4. That will be 4, 1 to 4, 8. That is a very simple trick. This formula is FDI. Here I am adding the number of quadrant 1, 1 to 1, 8, 2, 1 to 2, 8, 3, 1 to 3, 8, and 4, 1 to 4, 8. This is FDI. This is FDI. But sir, if I change the 3 and 4 position of the quadrant, yes, this is number 1. This is number 1 quadrant. Yes. This is number 2 quadrant. Yes, this is number 2. But 3 and 4 are changed, my dear friend. If you see 3 and 4 are exchanged, this will be a modified FDI. You can see in the FDI, it is 1, 2, 3, 4. That is a clockwise. And in FDI, 1, 2, 3, 4. In modified FDI, 3 and 4 are exchanged. This would be a modified FDI. So again, I'm revising, my dear friend. 1 to 8, 1 to 8, 1 to 8 formula is Palmer notation. Yes, it is a Palmer notation. Plus for the upper teeth and minus for the lower teeth, Hadrup formula. 1 to 16 and 17 to 32, that would be a universal or Cunningham method. If I am giving the number of quadrant, you can see FDI, number of quadrant 1, 2, 3, 4. I add the number in the number of teeth 1, 1 to 1, 8, 2, 1 to 2, 8, 3, 1 to 3, 8. 4, 1 to 4, 8, it would be FDI. And if I change the 3 and 4, that would be a modified FDI. So just give me the thumbs up to get this dental formula and click this question in your exam. आप पूरा सही करोगे कि what are the type of dental formula we can write down in the dental charting. बहुत important question है. अच्छे बच्चे गलत कर देते हैं. A road traffic accident with EDH when hitting on the Tyrion, which artery is going to be injured? Sir, it is EDH. In EDH, it is middle meningeal artery, beta. Option A is the correct answer. It is middle meningeal artery. In intracerebral hemorrhage, it is middle cerebral artery. Yes. Yes, mamma. Yes, in EDH, there is a hitting of mamma. That is a middle meningeal artery. In intracerebral hemorrhage, it is middle cerebral artery. In SAH, there is an interior communicating artery. You can remember SAH, A for anterior communicating artery. And in SDH, it is bridging veins. You can get all the types of question in your exam without any doubt. I discussed all. That is a why I am discussing all other option, because you can clear all the option and you can get any question in your exam and you will clear that one. Okay. So here answer is middle meningeal artery, middle cerebral artery for ICH, anterior communicating artery for SAH. Yes. And breathing vein, it is rupture is SDH. Thunderclap headache and genthochromia is seen in which hemorrhage? This is a very important question. I expect this question in your exam. Yes, anyone. Thunderclap headache and genthochromia, that is seen in which condition? Yes, it is BSAH, subarachnoid hemorrhage. It is subarachnoid hemorrhage. Now, sir, these are the questions you can get in your exam. 5 questions. Lucid interval is seen in EDH. Medical negligence charge is very, very common in EDH, because if you are not able to identify lucid interval, you can get medical negligence charge. Yes, in SAH, there is a worst headache. Thunderclap headache and genthochromia in SAH. Biconvex hemorrhage is EDH, and concavo-convex hemorrhage is SDH. So if you see in NCCT, biconvex hemorrhage, it is EDH, and concavo-convex sickle-shaped hemorrhage in SDH. So I expect one of the question of these 5 questions in your exam, you can get in your exam. Okay. Now, sir, this question is very important. Many people committed mistakes in the exam. Giving willful false evidence is punishable. It is not definition, my dear friend. Giving willful false evidence, which is known as perjury, is punishable under which BNS? Definition of perjury is 227, but the punishment of perjury is 229. Be careful, sir. Here punishment is asked. So punishment of perjury is 229 BNS. Okay. Perjury, how to remember? Yes, I am telling you the simplest trick. Perjury is 7 letter, my dear friend. Perjury is 7 letter. So definition of perjury is 227 and punishment of perjury is 229. So 227, perjury has a 7 letter. The definition is 7, 227. That is a false evidence. Okay. Now, sir, issuing a false certificate is punishable under which BNS? It is issuing a false certificate. 237, 238, 234, 230. Anyone who can give me the answer? Issuing a false certificate. Yes, again, it is 234. It is 234. Now, how to remember what trick I'm telling you? Sir, true sequence is 1, 2, 3. Beautifully done. True sequence is 1, 2, 3. And false sequence is 2, 3, 4. Because we are missing the 1. That is a very simple trick to remember. The issuing a false certificate is 2, 3, 4. True sequence is 1, 2, 3. And false sequence is 2, 3, 4. This is the way you can remember. If issuing a false certificate is punishable under 2, 3, 4. Beautifully done, my dear. Perjury, I already told you, define under 227 and punishable under 229. Yes, beautifully done. Okay, now this is a very important question. 196 BNSS is related with police inquest or magistrate inquest. It is not BNS, it is BNSS. BNSS is related for procedure. Yes. Is it for police inquest or magistrate inquest? Yes, my dear friend, absolutely right. It is a magistrate inquest. And I told you a very simple trick to remember. Police marti a chauka. So police inquest will be 194 BNSS and magistrate marta chakka. So magistrate inquest would be 196 BNSS. How to remember? Police marti a chauka and magistrate marta chakka. But sir, be careful. It is not BNS. It is BNSS. It is a procedure. Every procedure comes under BNSS. It is BNSS. Now, sir, police inquest, I'm coming to some MCQs of the police inquest. Police inquest is 194 BNSS. Yes, it is the most common inquest done in unnatural death, and the minimum rank of police officer is head constable. You can get this question in your exam. What is the minimum rank of police officer who can conduct the inquest? Is head constable. So the most common investigation in death in India is police inquest. And a very simple trick is police marti a chauka and magistrate marta chakka. It is done in unnatural death. Now, sir, magistrate inquest is 196 BNSS. It can be judicial magistrate or it can be executive magistrate. Now, what are the deaths in which magistrate conduct the inquest? A very simple trick I'm telling you, my dear friend. There are 6 deaths. You can remember A, B, C, D, E, F. These 6 deaths, magistrate conduct the inquest. A for asylum death, my dear friend. Yes. A for asylum death. B for police beating death. It is not normal beating, police beating death. C for police custody death. Again, police. D for dowry death, or any married woman dies within 7 years of her marriage. That is a very important case. E for exhumation. What is exhumation? Digging out of the dead body. And F for police firing. These are the 6 deaths. My dear friend, here magistrate inquest comes in action. A, B, C, D, E, F. Okay. Now there may be a judicial magistrate, there may be executive magistrate. What are the executive magistrate? Examples are DM, SDM or Tehsildar. Judicial magistrate are for police beating, for police custody, and for police firing. For all remaining cases, it would be executive magistrate. है ना? For judicial magistrate, it is police related death. एक ही line याद रखना. For judicial magistrate, it is a police related death. So these are two inquest system in India: police inquest and magistrate inquest. A very simple trick: police मारती है चौका और magistrate मारता है छक्का. I explained in a detail. The power of the first class judicial magistrate, now it is being changed, my dear friend. Be careful. What is your answer? The power of first class judicial magistrate, what is your answer? A, B, C, D. Yes, it is which one? First class judicial magistrate. It is C, 3-year imprisonment and 50,000 rupee fine. 3-year imprisonment and 50,000 rupee fine. Sir, these are the 4 magistrate which can give you death sentence and unlimited fine. What are 4 magistrate? Yes. No, now it's been changed, beta. Now it is not 10,000. I will explain. So these are the 4 magistrates: Supreme Court, High Court, Session Court, and additional Session Court magistrate can give you death sentence and unlimited fine. Yes, I'll come to that point, beta. Okay. Now, sir, very, very beautiful. It is Assistant Session Court, Chief Judicial Magistrate Court, First Class Judicial Magistrate Court, and Second Class Judicial Magistrate Court. The punishment in year are 10 year, 7 year, 3 year, 1 year. Again, I'm revising: Assistant Session Court, Chief Judicial Magistrate Court, First Class Judicial Magistrate Court, and Second Class Judicial Magistrate Court. It is 10, 7, 3, 1. Now, what about the fine? First Class Judicial Magistrate is 50,000 and Second Class Judicial is 10,000. So here I'm writing, if it is not visible, all remaining will be unlimited fine. So that has been a change. Be careful in exam. First Class Judicial Magistrate, it is 3-year imprisonment and 50,000 rupee fine. Second class, 1 year imprisonment and 10,000 rupee fine. Assistant Session Court 10 year and Chief Judicial Magistrate 7 years. So this is a very important table to click in your exam. पक्का एग्जाम में जाने से पहले टेबल पढ़ के जाना आपके लिए बहुत इंपॉर्टेंट है. Okay, dear? Now, which of the following eye sign can be seen in the eye? This is a very simple question. I expect all that people to correct this answer. What is this? It is anyone? Give me the answer, beta. It is Takenoir. It is Takenoir. You can see the Takenoir are the sclera changes, my dear friend. I expect this question again and again in exam. It is seen in 3 to 6 hours as a triangular yellowish change that is known as Takenoir. It is seen in 3 hours, the triangular yellowish change. It becomes brown and black after certain time. It is known as Takenoir. It is known as Takenoir. But sir, if you get the Takenoir, you can get one more question in your exam. That is another eye sign. That is a Kevorkian sign. It is the earliest eye sign, my dear friend. It is the earliest eye sign. It is also known as railroad sign. Here your retinal vessels are fragmented. It is known as a railroad sign. Here your retinal vessels are fragmented. So this is another important death change. That is a Kevorkian sign. That is a Kevorkian sign. Now, sir, identify the postmortem change given in the following image. Anyone who can give me the right answer, beta? Identify the postmortem change given in the following image. Anyone? It is none other than marbling, my dear friend. It is none other than marbling. Yes, beautifully done. What is marbling? I'll come to all the point. Marbling is a change which is a death change. The sites of marbling are chest, shoulder, abdomen, and thigh. This is a potential MCQ. It starts in 24 hours. Maximum marbling is seen in 36 to 48 hours. It is greenish brown in color because of sulfa hemoglobin. You can get this question in your exam. It is greenish brown in color because of sulfa hemoglobin. This phenomena is known as marbling. This very important phenomena is marbling. So I told you all the important MCQ of the marbling start in 24 hours. Maximum marbling in 36 to 48 hours. Yes, beautifully done. Sir, maggots are larvae of fly seen in 1 to 2 days. In rainy season, maggots are seen very early, and the study of maggot is known as entomology. You can get a question. It's a larva of the fly seen in 1 to 2 days. In rainy season, it comes very early. And the study of maggot is known as entomology. Okay. Match the following weapon and the possible injury caused by them. It's a very simple question. The X causes chop wound, very important one. Yes, X causes chop wound. In road traffic accident, we have a grazed abrasion. Yes, my dear friend, because in road traffic accident, we slide on the road, there is a grazed abrasion. The blade causes incise wound, a sharp edge weapon causes incise wound, and the lathi causes tram track bruise. The lathi causes tram track bruise or railway line bruise. Okay. So here correct answer is A4. Okay, I'll come to the all important explanation. The grazed abrasion or the brush burn. Yes, my dear friend. The grazed abrasion, which is also known as brush burn. It looks like a brush and it gives burning sensation. It is known as a brush burn. So when you are sliding on the road, there is a grazed abrasion. Okay, so you can get this picture also in exam. This is a grazed abrasion or brush burn. Abrasion is an injury of epidermis. Abrasion is an injury of epidermis. Okay, now sir, second, the tramline bruise or the pattern bruise are caused by lathi or road. The tramline bruise or pattern bruise are caused by lathi or road. So this is another very important question comes in exam. It is a pattern contusion or pattern bruise. Okay. Now, sir, this is another very, very potential MCQ. A body of a 45-year-old male with a known history of HIV infection. Here, the catchy point is a transmissible disease, HIV infection, has been sent for the postmortem investigation. Which best method for organ removal you will use in this autopsy case? It is a rocket and scheme method. And Dr. Saab, I can tell you a very simple trick, जो आप कभी नहीं भूलोगे. HIV spread like a rocket. HIV spread like a rocket. So any HIV case, in any COVID-19 case, we go for Rokitansky. Yes, for COVID-19, Gautam Raj Gupta, I already told you. I'll discuss the old method. The most common method is a virtuous method. The most common method is a virtuous method. It is a one-by-one organ removal. This is the most common method. In transmissible disease, we use Rokitansky method. Here trick is given. That is HIV spread like a rocket. HIV spread like a rocket. Okay. So here we go for in situ method. Rokitansky is an in situ method. We are not taking any organ out. Yes. Yes. Hepatitis B also Rokitansky. Absolutely right. If we are taking block out, we can remember by a trick GB. B for block, G for Gons method. So we are taking cervical, thoracic, abdominal or pelvic block one by one. That is a Gons method. And if we are taking mass, the complete mass as it is out, that is a Lutule method. You can remember L for Lutule, L for large mass dissection. The complete mass is taken out. This would be a Lutule method. This would be a Lutule method. So just be careful, my dear friend. One by one organ removal is virtuous method. If we are doing transmissible disease, Rokitansky method. The child is very simple. Child will go for same, my dear friend. Don't worry. Child will go for, it depends what method you use. Okay. If the child is having certain disease, we'll go for like block method or virtuous method. But if we are taking the complete mass as it is out, that would be a Lutule method. L for Lutule, L for large mass. If you get a question, which is the en masse method, Lutule method, and which is a block method, that will be a Gons method. Okay. As I discussed here. An accused person is not criminally responsible if at the time of committing the crime, he didn't have the capacity to regulate the conduct of the crime. Which rule is that? Anyone? That is a occurrence rule. That is a occurrence rule. I'll discuss the remaining rule also. Okay. Now, if the unsoundness of mind word is given, that would be a McNaughton rule, my dear friend. If unsoundness of the mind word is given, that would be a McNaughton rule. You can see unsound, McNaughton. Defect of reason word is given, again McNaughton rule. If loss of capacity word is given, that would be a occurrence rule, CC. And if the product word is given, DU, that would be a Durham's rule. Again, I'm telling you, if unsoundness of mind word is given, U1 McNaughton rule, the capacity is lost, that is given occurrence rule. And if the product of mental disease is given, that would be a Durham's rule. So be careful about these rules, my dear friend, in your exam. Now, a 32-year-old female librarian is displaying unusual behavior and thought pattern have raised concern among her friend and colleague. Over the past few months, she has been increasingly preoccupied the idea that a famous author is madly in love with her. A famous author is madly in love with her. So that is a D. Clerambault syndrome or erotomania. Yes, absolutely right. It is also known as erotomania. What is Ekbom syndrome, my dear friend? Ekbom syndrome is nothing. It is you feel you are infested by parasite. That is Ekbom syndrome. And what is a Othello syndrome? I'll discuss here. Okay. So if you feel like someone big party loves me, अगर आपको लगता है कोई बहुत बड़ा आदमी मेरे को प्यार करता है, that is a D. Clerambault syndrome or erotomania. And Ekbom syndrome, you feel like you are infested by parasite. Okay. Now I'll come to a few very, very important questions. Yes, Othello, absolutely right. I'm coming to delusion of double. Delusion of double are two types, Capgras syndrome and Fregoli syndrome. Okay. In Capgras, ध्यान से देखना, A and P अपना look like pariah. अपना look like pariah means familiar look like stranger. That is A. No need to explain. That is option C, querulous paranoia. No need to option. That is related with psychiatry. Okay. But you come to apna look like pariah, that familiar look like stranger, that is a Capgras syndrome. Okay, Capgras syndrome. Opposite is Fregoli syndrome, stranger look like familiar. Yes or no, my dear friend? Fregoli is stranger look like familiar. So that is a trick to remember. Apna look like pariah is a Capgras and stranger look like familiar, it's a Fregoli. Now there are two more delusion, delusion of infidelity. Delusion of infidelity means very simple trick. आपको ऐसा लगता है आपका पार्टनर बेवफा है. It's a delusion of loyalty. So what you will say to your partner, आप अपने पार्टनर को क्या बोलोगे कि यार भैया तुम मेरे से बेवफा हो, तुम मेरे से वफा ही नहीं करते हो. आप अपने पार्टनर को क्या बोलोगे? Othello. That would be a Othello syndrome. It's a delusion of infidelity. And delusion of love or erotomania is delusion which is known as D. Clerambault syndrome. Like here you feel that Bolt loves me, Usain Bolt loves me. That's a D. Clerambault syndrome. है ना, बहुत इजी तरीके से याद कर लेना, बोल्ट मेरे से प्यार करता है ना, तो दैट इज अ डी क्लेरम्बोल्ट. और बेवफाई को कहते हो ओथेलो सिंड्रोम. अपना लुक लाइक पराया कैपग्रास सिंड्रोम एंड स्ट्रेंजर लुक लाइक फेमिलियर, दैट्स अ फ्रेगोली सिंड्रोम. नाउ सर, व्हिच ऑफ द फॉलोइंग इज कंसीडर्ड एज अ ब्रेसलाउ सेकंड लाइफ टेस्ट, माय डियर फ्रेंड? Here they are asking about the Breslau second life test. Second life test is a air in stomach and intestine. First life test is related with air in lungs, and second life is a air in stomach and intestine. How would you remember? Your first life is lung and second life is stomach. That is a trick to remember. Your first life is lung and second life is stomach. Okay, sir, what are the tests for live birth? First test, very beautifully explained. Radine test is a test in air in ear. So radine has E and E. If your air in ear present, it's a radine test positive. Second test, Fodray test is a test of lung weight. For Fodray test is a lung weight. For no respiration, the lung weight is 30 gram. For respiration present, the lung weight is 60 gram. That is a twofold. So if your lung weight become twofold, fold for Fodray test. What is a wonderful trick here? Fold for Fodray test. Yes, fold for. If your lung weight become twofold, it's a Fodray test. The third test is a Plockweight test. Here I'm highlighting P. P for Plockweight, P for related with proportion. So it is a proportion of lung weight divided by body weight. Here it is a proportion of lung weight divided by body weight. From 170 after respiration, it becomes 135. What is the trick to remember? P for Plockweight, P for proportion of lung weight divided by body weight. Okay. Now, sir, as I told you, Breslau first life test and second life test. As I told you, what is your first life? आपकी पहली life क्या है? Lung, है ना? So air in lung, we use a lung for flotation. That is a Breslau first life test. And air in stomach and intestine, that is a Breslau second life test. So I think you got all the point. Air in ear, Radine test. Lung weight become twofold. That is a lung weight become twofold. That is a Fodray test. Lung weight and body weight proportion from 170 become 135. That's a Plockweight test. And air in lung, that's a Breslau first life test. And air in stomach, that is a Breslau second life test. I think these are the very important tests for live birth. Okay, my dear friend. बड़ा अच्छा एक्सप्लेन कर दिया ना. टू फोल्ड, फोल्ड फॉर फोडरे, पी फॉर प्लकवेट, पी फॉर प्रपोर्शन. ना बेटा, कभी गलती मत करना. डोंट कमिट मिस्टेक. ओके, वंडरफुली डन. चलो, Sir, in MTP Act, the opinion of two registered medical practitioners is required for termination of pregnancy at which gestational age? 2 is required for the gestational age between 20 to 24 weeks. I'll discuss the MTP Act. Sir, in MTP Act, the consent is required from mother and the age of mother should be above 18. Yes. If the age is below 18, we require the consent of legal guardian. MTP is performed up to 24 weeks. Up to 20 week, we require one doctor for MTP, and 20 to 24 week, we require two doctors for MTP. This I explained here. The question was 20 to 24, we require two doctors. Okay, I'll explain a few more important points. MTP Act was implemented in 1971. The new amendment came in 2021. What are the indication of MTP? Number one, contraceptive failure is a social indication. अगर आपका contraceptive fail हो जाए तो you can go for MTP. Congenital malformation is a eugenic indication. That is, eugenic is a genetic congenital malformation. If the fetus is malformed, that is a eugenic indication. Mother risk of life is a therapeutic indication, yes. And any drug congenital malformation is a teratogenic, or torch infection is again a teratogenic indication. Now, rape of a victim is a humanitarian indication. By rape ho gaya, to that is a humanitarian manavta ka adhikar. So contraceptive failure is a social indication. Genetic malformation, that is a eugenic indication. Mother's life in danger, that's a therapeutic indication. Drug causing malformation, teratogenic indication. Torch infection, another very, very important. Yes, if the drug fails like estrogen, then social, sir. Yes, no, it is like, this is a social. If the estrogen or oral contraceptive fail, that's a social indication. Yes, absolutely right. Rape is a humanitarian indication, beta. Rape is a humanitarian indication. Now, here again, the mother consent is taken. Mother should be more than 18 years. If you breach the confidentiality of mother, तो सब गलती से भी mother का नाम मत बताना. There will be 1 year and fine or both punishment would be applicable. है ना? गलती से भी मत करना. Now, sir, for contraceptive failure, MTP is done up to 20 weeks. Yes, up to 20 weeks. For pregnancy, rape, incest, and vulnerable female, MTP can be done up to 24 weeks. But sir, fetal abnormality, here it can be done up to 20 weeks and even after 24 weeks with the help of medical board. What are the member of medical board? Gynecologist, pediatrician, radiologist or sonologist or any other member. And a gazetted officer. That is one member which is a gazetted officer. But it is applicable when the fetal abnormality or congenital abnormality is more than 24 weeks. But sir, this is my favorite point. MTP can be done any time to save the life of pregnant woman. That is a therapeutic indication, even with one doctor. That is an exception. So mostly for contraceptive failure up to 20 weeks. For rape cases up to 24 weeks, yes. For fetal abnormality more than 24 weeks, we make a medical board. And here, yes, it is obstetric. Any recognized institute by government is for MTP can be used. Okay. Now for obstetrics, pediatrician, radiologist, or any other member, we use a medical board. And any time, that's my catchy point. MTP can be done any time to save the life of pregnant woman. That is a beauty, even by one doctor. This is a very important point. है ना? अगर माँ की जान खतरे में, तो we can do MTP at any time. So these are some very clinical questions and very important question you can get in your exam. गलती मत करना, है ना? चलो, this. A person who may be important for a particular woman is known as quad, frigidity, atavistic form, none of the above. Yes, tell me. Who is important for a particular woman? If you are अगर आप एक औरत के लिए नाम मत दो, है ना? मतलब आप बाकी सब के लिए most welcome, but you are important for a particular woman. That is known as quad. What is frigidity? I'll discuss. Frigidity is a female rigid. And what is atavistic form? The reappearance of a trait. Reappearance of a trait for like very distant ancestor. मतलब आपके पूर्वजों के trait आपके आगे. That is known as atavism. You are getting some genetic or reappearance, genetic reappearance that is from trait. That is a atavistic or atavism. Like you are getting the features of the grandparents or the grandparents. That is atavism. Okay. Anyways, this is quad. What is posthumous child? I'm getting 3 important definition. What is posthumous child? Child born after death of father. Post means after, humans means death of father. Affiliation case is a case of disputed paternity or maternity. That is affiliation case. And quad is a person who is important for a particular. What is a person who is important for a particular person, particular woman, particular meaning? That is three important definition I discussed. Posthumous child, child born after death of father. What if you are important for a particular person? Okay. Now, sir, what is the term for a child born when a woman pretends to be pregnant? Yes, beautiful question. When woman pretends to be pregnant and later uses the child to extort a man. She pretending that she is pregnant and she wants money. Actually, uska motive hai paisa. She wants money. So what is this? This is a supposititious child. What is superfecundation? Posthumous child, I already told you, a child born after death of father. What is superfecundation and superfetation? I'll tell you, don't worry. But sir, this is if you pretend to be a pregnant and you want money, that is a supposititious child, fictitious child, or substituted child. It is supposititious child, fictitious child, or substituted child. That is a very, very potential MCQ. Okay. Now, sir, I'm coming to two very, very important definitions, superfecundation and superfetation. And what trick Jhamad sir has for you? Superfecundation has 1T. So this incidents take place in same cycle 1T, but superfetation has 2T. So this particular incidence happens in 2 MC cycle. All remaining are same. In 1 MC cycle, 2 ova fertilized by 2 act of coitus by same or different men, may be the same age of the fetus. That is superfecundation. But in 2 different MC cycle, 2 ova fertilized by 2 act of coitus by same or different men, and there will be almost 1 month difference of a fetus age. That would be superfetation. In 1T, that is 1T. Yes, 1T, that is same MC cycle, 2 ova fertilized, and in 2T, 2 MC cycle 2 ova fertilized. That's a beautifully explained superfecundation and fetation. Medical negligence comes under which BNS, my dear friend? Give me the answer. This is a very important question, I expect. And here the punishment is up to 2 years, plus minus 5. Now, medical negligence is punishable under 106 BNS. It is 106 BNS. So this is punishment of murder. M look like 3. Punishment of murder. M look like 3. The punishment of murder is 103. And punishment of medical negligence or any kind of negligence is 106. How would you remember? एक डॉक्टर ने 0 काम किया, पिछवाड़े पे छक्का लगा. That's a very simple trick. एक डॉक्टर ने 0 मतलब नेग्लिजेंस किया, पिछवाड़े पे छक्का लगा. That is very simple trick. एक डॉक्टर ने 0 काम किया, पिछवाड़े पे छक्का लगा. That is 106 is for medical negligence. Okay. The punishment for murder, without any doubt, it is 103 because M look like 3. Okay. Chalo. Now, sir, the fetishism is sexual gratification. My dear friend, fetishism is sexual gratification is dressing the opposite sex or like using opposite sex object. Give me the answer. What is your answer here? Tell me, dear, it is. It is anyone. B. If you are using opposite sex object, that is a fetishism. Now I'm coming to few sexual perversion. My dear friend, sexual perversion are also known as paraphilia. P for perversion, P for paraphilia. Yes, paraphilia. If you are giving pain to the partner, it is known as sadism or algolegnia. If you are giving pain to the partner, it is sadism or algolegnia. If you want to suffering pain from the partner, it is masochism and passive algolegnia. So giving pain to the partner is sadism or algolegnia, and suffering pain from the partner is masochism and passive algolegnia. If you are eating dead body or sex with dead body, these are eating dead body is necrophagia and sex with dead body is necrophilia. If you are showing genitalia and you are running in public place naked, nude, that is a sticking. So exhibitionism is showing your genitalia, and if you are running nude or naked in public place, that is exhibitionism. Sir, these two are very important. Wearing opposite sex clothes, it is known as trans, because what is the meaning of trans? Trans means opposite, vest means clothes. Trans means opposite, vest means clothes. But sir, in your exam, you won't get a question of transvestism. You will get a option eonism. So I'm highlighting, sir, wearing opposite sex clothes is transvestism or eonism. But but opposite sex article, if you are using, that is fetishism. Like if I am male but I'm using female panty to get sexual gratification, it is fetishism. जैसे कि एक बच्चे ने बोला फटी हुई चीज से मजा लेना, that is fetishism. कोई भी फटी हुई चीज उठा लेंगे, you are enjoying by मजा ले रहे हो, that is fetishism. Okay, wearing opposite sex clothes is transvestism or eonism, and फटी हुई चीज से inanimate object, that is fetishism. Okay. Now, sir, a man is brought by his wife as he calls other women and achieves sexual gratification by talking obscenity. Oh, gandi baat, है ना? Gandi, 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 gandi baat. Talking obscenity and sharing obscene picture. That is known as none other than what, my dear friends? Scatologia. It is scatologia. It is scatologia. I'll discuss the remaining one. Yes, my dear friend. Oprophilia is satisfaction by feces. Satisfaction by feces or stool, that is a coprophilia. Yes. But if you are talking obscenity and talking obscene picture, sharing obscene picture, that is this one. Now, sir, what is frotteurism? You can see the trick. Frotteurism is F and R. So if you rub the F and R, female is rubbed in the clouded place. That is frotteurism. Beautifully done. Obscene picture, you can pick this one. आप देख सकते हो obscene pictures, obscene mobile call, that is scatologia. Excessive sexual desire in female, it is nymphomania. And excessive sexual desire in male, satyriasis, asis, male. And teacher beating the student by danda. Teacher beating the student by danda, D for defaultism. If you are a teacher and you are sexually gratified by beating the teacher, beating the student, not teacher, that is defaultism. Excessive sexual desire in female is nymphomania. Excessive sexual desire in male is satyriasis. हिंदी में दोनों को ठरकी बोलते हैं, but female ठरकी is nymphomania and male ठरकी is satyriasis. है ना? बिल्कुल आसान सी बात. Sir, which test is employed? Doctor, be careful. Here the question is asked, which test is employed for human blood for other species to distinguish? My dear friend, for species identification, we do precipitin test. For species identification, we do precipitin test. Doesn't matter blood, any species, for bones, for hair, for blood or semen, whatever we species identification, we do precipitin test. है ना? कुछ question देख लेते हैं. For blood stain, what are the tests, my dear friend? Teachman test for blood stain. Man has a brown color. So Teachman gives brown rhombic crystal. Man का color brown होता है, and it is a hemine crystal. Blood stain test. Takayama. Takatak. Which color is a Takatak color? If you get something pink color in your life, अगर आपको कोई गुलाबी चीज मिल जाए लाइफ में, your life become Takatak. That is pink feathery crystal. That is a Takayama test. Okay, very, very important. It is hemochromogen crystal. So pink feathery crystal, अगर आपको गुलाबी चीज मिल जाए, your life become Takatak. Most specific test for blood stain is spectroscopy, SPSP. Or for species, we do precipitin test. That's a beauty, my dear friend. So Teachman gives brown color hemine crystal. Takayama, your light become Takatak when you get the pinkish in your light. Spectroscopy is the most specific for blood stain. Species, we do precipitin. Now you can see pink feathery crystal. Tell me. Yes, now give me the answer. Pink feathery crystal. Which test is this? When your light become Takatak. Give me the answer. Anna? Yes, it is Takayama. It is Takayama. You can see both the tests for blood stain. For Teachman, the man has a brown color, brown rhombic crystal. And Takayama has a pink feathery crystal. Your life become Takatak. Your life become Takatak if you get something pinkish in your life. अगर आपको गुलाबी सामान मिल जाए तो आपकी life हो जाएगी Takatak. Yes. Now, sir, these were the tests for blood. What about the semen test, my dear friend? Florence has C. C for semen. Florence test detect choline crystal. Choline, you can remember by Kohli. Choline, you can remember by Kohli. The color of choline crystal are brown rhombic. So this is the first test for semen, Florence. The second test for semen is Barbeрио's. Yes, my dear friend. Barbeрио's has S. It is spermine crystal. And it is Barber use yellow needle. So it is spermine is a yellow needle crystal. The spermine are because of picrate used in Barbeрио's test. And the most specific test for semen is Most specific test for semen is LDH. LDH. The L is the word by which semen is there. So it is LDH. Lactate dehydrogenase. Yes, Aparna, absolutely right. Barber, pick your hair with yellow needle. Barbados, we detect spermine crystal, the yellow needle. Semen Florence test for choline. Choline color is brown, rhombic. And the most specific test for semen would be LDH. LDH. Yes, beautifully done. Now, sir, this is a Florence test, the dark brown rhombic crystal. Yes, the choline. Choline has a dark brown color. In Florence test, we use potassium iodide. In Florence test, we use potassium iodide. Yes. Now, the second, it is a brown. So, it's a Barbados test. It detects Barbados has S, spermine crystal. And as I told you, it is a spermine picrate. Picrate always gives yellow color. So, barbers use yellow needle. Barber use yellow needle. That is a very important test, Barbados test. Yellow needle shaped crystal. है ना देखो Florence has a C for choline crystal, Barbados has S for spermine crystal. बार्बर यूज येलो नीडल है ना, बहुत इजी ट्रिक से याद कर दिया. येलो नीडल शेप क्रिस्टल, दीज आर द टेस्ट फॉर सीमन. बार्बेरियोस, स्पर्मीन क्रिस्टल, पिक्रेट, स्पर्मीन पिक्रेट. चलो, ब्रश बर्न इज अ टाइप ऑफ विच इंजरी माय डियर फ्रेंड? यस, ब्यूटीफुल क्वेश्चन. Brush burn is a type of which injury? Yes, it is a, I already discussed, it is a graze abrasion. Dr. Sahab, the name is brush burn, but it is not a burn. The name is brush burn. It is not a burn. It is a type of abrasion. This is a graze abrasion. So abrasion is a loss of epidermis. The graze abrasion is also known as brush burn. And graze abrasion is the most common abrasion of the road traffic accident. If you had a question, which is the most common abrasion of the road traffic accident, the answer would be graze abrasion. It is also known as brush burn. This is a very, very important picture of graze abrasion. It is sliding on the road. आप जैसे ही road पे गिरते हो, there is a graze abrasion. So it is brush burn. So this is another abrasion, scratch abrasion. Another abrasion is scratch abrasion. This scratch abrasion is abrasion caused by nail and thorn. Yes, my dear friend. This scratch abrasion is a, yes, abrasion caused by nail and thorn. In Hindi, it is known as kharoch. It's a scratch abrasion. It is a scratch abrasion. Now, sir, the tire mark is an imprint or pattern abrasion. The tire mark is a imprint or pattern abrasion. So there will be a pattern formation on the body. This is a tire mark, which is also known as imprint or pattern abrasion. Yes, absolutely right. Tangential. So during the examination of a victim of assault, we noticed a wound with ragged, very important question. See the catchy point, ragged, irregular and uneven margin and tear diverging at the angle from the end of the main wound, and typically it is a swallowtail. So I will pick three important words: swallowtail, irregular and uneven margin, and tear diverging at the angle. Bleeding of the wound is not significant, and there is a very important catchy point that is my favorite: crushed blood vessels and hair bulb. So if there is a crushing of the blood vessels and hair bulb, it is without any doubt laceration. And here in laceration, we have swallowtail. Here in laceration, we have swallowtail. In stab injury, my dear friend, if you see the stab injury, there will be fishtailing. In stab injury, there will be fishtailing. So swallowtail is a very important feature of laceration, and fishtailing is very important feature of stab wound. Okay. So now, what are the catchy point? Irregular margin, swallowtail, bleeding is not significant, and crushed blood vessels and hair bulb. Crushing of the tissue, that's very important. Crushing of the blood vessels and hair bulb, that is laceration. Fishtailing is seen in stab injury. Yes. Dead body was found and there is a wound on the neck with clean cut edges. My dear friend, what are the catchy point? You can see clean cut edges, crushed tissue along with disruption of the vertebral bone. Yes. Clean cut edges, crushed tissue along with the disruption of vertebral bone. Tell me, what is the type of the wound this is? Incise, chop, laceration, or avulsion? Anyway, it is a chop wound. Chop wound is caused by a heavy sharp edge weapon. A very important example, the chop wound causes heavy sharp edge weapon, that is an axe. If you see, this is the axe. This is heavy sharp edge weapon. Now, sir, because of the heavy, there is a crushed tissue. And because of the sharp edge, there's a clean cut edges. And because of the heavy weapon, yes, incised, not incised because it's a crushed blood vessels. Yes, my dear friend, absolutely right. So because of the heaviness of the weapon, there's a crushed tissue. Because of the sharp edge, there's a clean cut edges. And because of the heavy weapon, there's a disruption of the vertebral bone. So these all are the feature of chop wound. These all are the feature of none other than chop wound. Now, sir, active defense wound are seen where? There are two defense wound, active defense wound and passive defense wound. What is the meaning of defense wound? When you defend yourself. Avulsion, yes, someone is asking about the avulsion. Avulsion is a type of laceration, my dear friend. Avulsion is a type of laceration which is seen by horizontal force, or you will see the word rotational force. So if any rotational force, the skin comes out, that is known as avulsion. Yes, that is known as avulsion. Any rotational force, the skin comes out, that is known as avulsion. Anyways, the question is, active defense wound are seen in which type of injury? What are the sites of active defense wound? Yes, the site of active defense wound is palmar aspect of the hand. You can see there are two type of defense wound, active. What is active defense wound? Like this, see, someone is hitting you and you are holding or grasping the weapon. That is active defense wound. So it is common on the palmar surface or the web surface. Now, what is passive defense wound? You are defending like this. So it is seen on your extensor surface of forearm and hand. That would be a passive defense wound. So again, I'm telling you, my dear friend, if you grasp the weapon, palmar surface or web space, this is active defense wound. And if you defend in this manner, that is a passive defense wound. That is known as passive defense wound. So be careful about this defense wound. Now, sir, a 30-year-old pedestrian is hit by a car and there is a tibial fracture on the left leg and contusion over the scalp. Which type of impact injury or tibial fracture is a which injury? Is a primary impact, secondary impact, tertiary impact, or run-over injury? Tell me, dear. Here it is, primary impact injury. So hitting on the car, the first impact by bumper, that is a bumper fracture. It is a primary impact. Don't worry, I'll explain. See, the first impact injury on the leg is a primary impact injury. Now you are going to the bonnet. You are going to the bonnet or glass. This is a secondary impact injury. This is a hitting on the leg is a primary impact. You are going over the bonnet or the glass. This is a secondary impact. Now you are hitting the ground. That is a tertiary impact injury. Again, I'm revising, my dear friend. The hitting on the leg, that is a primary impact. The glass or bonnet you are hitting, that is a secondary impact, and hitting on the ground, that would be a tertiary impact. Now, I'll explain again. Primary impact injury in the leg will cause bumper fracture. Primary impact injury in the leg will cause bumper fracture. This I mentioned, the bumper fracture is a fracture of tibia bone. Bumper fracture is a fracture of tibia bone, mostly. Secondary impact injury is by glass and bonnet. And tertiary impact is hitting on the ground. So what you will see the multiple graze abrasion in the tire mark. So there are two possibilities. There are multiple graze abrasion or tire mark are tertiary impact injury. But sir, my question is tertiary impact is also known as secondary injury. Tertiary impact is also known as secondary injury. So again, I'm revising. Hitting on the leg and bumper fracture or tibia fracture is a primary impact injury. Glass and bonnet, glass और bonnet पे जाके गिर गए आप तो second impact injury. Hitting on the ground, multiple graze abrasion, tire mark are tertiary impact, but in your exam you won't get a tertiary impact, you will get a word. Yes, अभी आएगा बेटा, blast injury I'll discuss. Okay, that is a secondary injury. जैसे कि पूछा, you will get the question of the blast injury or not. Yes, I had this very important word. Now, sir, same manner there's a primary blast, secondary blast, tertiary blast and quaternary blast injury. कहते हैं ना जामर सर को मालूम है कि आप क्या पूछना चाहते हो. Primary blast is due to air compression, so there will be rupture of tympanic membrane, then lung. So air compression and rupture of tympanic membrane and lung, that is a primary blast injury. Flying missiles, my dear friend, hitting your body. Flying missiles hitting your body is a secondary blast injury, and flying missiles that will cause punctate abrasion, punctate contusion, and punctate laceration. This is known as Marshall triad. One thing is clear, Marshall triad is a secondary blast injury. You are hitting the ground, that is a tertiary blast injury. And burn and flame causes injury, that is a quaternary blast injury. So air compression is a primary blast. Flying missile hitting the body. Okay, that doesn't matter. That's a different thing, Gautam Raj Gupta. Because if it is hitting from the other side, that's a different thing. If it is hitting from the front or back side, that will be a tibial fracture, primary impact fracture. So flying missile hitting the body is a secondary blast injury. You are hitting the ground is a tertiary blast injury. And burn or flame causes quaternary blast injury. So Marshall triad, this question will come in your exam. Punctate abrasion, contusion or laceration is a Marshall triad that would be seen in secondary blast injury. Be careful about this option also. The law facies sympathetic is a condition. Tell me, pupil is dilated at the side of the knot or opposite side of the knot? Tell me dear. Law facies sympathetic. Pupil is dilated at the side of knot. Dribbling of saliva is seen at opposite side of the knot. I'll discuss. So on hanging or antemortem hanging, there are two findings. One is dribbling of saliva. Dribbling of saliva is because if you have a knot here, the maximum pressure will be in the opposite side. Dribbling of saliva is at the opposite side of the knot, but la facies sympathetic is at the same side of the knot. In same side, the eye remain open and pupil is dilating. This condition is known as la facies sympathetic. Now tell me, la facies sympathetic, this question recently asked in the INICET exam. La facies sympathetic is due to stimulation of which ganglion? That is a stimulation of cervical sympathetic ganglion. Yes, that is due to stimulation of cervical sympathetic ganglion. That's what that was a question. Okay. Dribbling of saliva is due to compression of the opposite side of pterygopalatine ganglion. Okay. Dribbling of saliva is due to opposite side of pterygopalatine ganglion. That's a submandibular gland. Okay. So these are two questions which can be asked about the antemortem hanging. This is the V-shaped ligature mark in antemortem hanging. Now, sir, in antemortem drowning, the best or most characteristic finding is cadaveric spasm. What is cadaveric spasm? Your hand are clenched and some grasp present in it. That's a cadaveric spasm. In antemortem burn, the most characteristic finding is soot particle or carbon particle in trachea. And in antemortem hanging, the most characteristic finding is dribbling of saliva. So in antemortem drowning, yes, my dear friend, in antemortem drowning, the most characteristic finding is cadaveric spasm. Yes. In antemortem burn, the most characteristic finding is soot particle in trachea. And in antemortem hanging, the most characteristic finding is dribbling of saliva. These are three very important questions of the antemortem things. Now, sir, what type of strangulation method is Spanish windlass? Anyone? Bensadola, garroting, mugging, throttling. It is garroting. The type of method, if it is not Bensadola. Incorrectly, it is mentioned here. It is garroting, my dear friend. Spanish windlass is garroting. It is not Bensadola. Bensadola means baans ke beech mein dola. There is a baans stick. Your neck is held between stick. It is garroting. Now, sir, what are the type of strangulation? Ligature strangulation. First number. Yes. Number two, manual strangulation. That is this one, throttling. Number three, the strangulation. Yes, the strangulation is between band of elbow and forearm. That is known as mugging. Yes. Fourth, bamboo stick. Baans ke beech mein dola, bensadola. Bamboo stick, you are constricting the neck. That's a bensadola. And garroting is a judicial strangulation, Spanish windlass. So by ligature, you strangulate ligature. This is manual strangulation, throttling. The bend of elbow or forearm strangulation, mugging. Between baans, if the neck is dola, that is the bensadola, bamboo sticks. And judicial strangulation, this is Spanish windlass, my dear friend. This is very common in Spain. This is garroting. This is garroting. Preauricular sulcus, the attachment of anterior sacroiliac ligament is useful for determination of age, sex, race, and stature. Anyone give me the answer? Preauricular sulcus, it is sex. I will explain a few very important differences between male and female skeleton. So there's a first rule. Yes, there's a first rule, Ashley rule. How to remember? Ashley rule S, it is used for sternum bone. Ashley rule is S for sternum bone. Sternum length is more in male and less in female. All bony prominences are more in male, yes. But frontal or parietal eminence. F for female, F for frontal. Female is like a parietal eminence. These are two eminence which are more prominent in female. Preauricular sulcus, yes, it is present in female, absent in male. Preauricular sulcus present in female. That's why it's a very important method to determine sexual differentiation. It is present in female. Obturator foramen start with O, oval shape in male, and T, triangular in female. That's a beautiful trick. All foramen are round shape in female, but obturator foramen, yes, obturator foramen oval in male and triangular in female. OT. Best bony index to differentiate male and female is sciatic notch index. Pelvic inlet are heart shape in male and round shape in female. All the things are round in female except obturator foramen. Ischial tuberosity start with I, that is inverted in male and inverted in female. I. Ischial tuberosity inverted in male and inverted in female. Yes, absolutely right. And all angle are V shape and less in male and U shape and more in female. U shape and more in female. Yes. Again, I'm talking about the last to differentiate. Ischial tuberosity is inverted I in male and inverted in female. All angle are less and V shape in male, U shape and more in female. That is a very important table to remember what are the important difference for male and female skeleton. This is a very important table, beta. Most of the things are round in female, but obturator foramen is triangular in female. Preauricular sulcus mainly present in female, absent in male. All bony prominence are more prominent in male, but frontal and parietal eminence are more prominent in female. Ashley rule is used for sternum bone. The sternum bone length is more in male, less in female. So इसको गलती मत करना. I for ischial tuberosity, I for inverted in male, inverted in female. Angle are V shape and less in male and U shape and more in female. Okay. A surgeon returns from a home after a party and there he had alcohol and emergency operation. There was a hand shaking and instrument falling. Eventually, there was a nick on the artery and the patient collapses. What is this? Is it a civil negligence or criminal negligence? Yes, tell me. It is a criminal negligence, my dear friend. Now, sir, what is the difference between civil and criminal negligence? Civil is a mild negligence. Negligence is also known as tort. Yes. Here, burden of proof goes toward the patient. Here, punishment is money. So it is in civil court or consumer court. Yes. It is trialed in civil court or consumer court. Example, there was the overdose of a drug which is causing side effect. So civil negligence, as you can see, yes, mild negligence, tort, burden of proof goes to the patient. Punishment is money. In civil court and consumer court, it is trialed. Example, overdose of a drug causing side effect. But if you see criminal negligence, it is a gross negligence. Burden of proof goes towards the doctor needs to prove that there was no negligence from my side. Here, not only money, but 106, my dear friend, not only money, but 106 also comes in action. Yes. 106 BNS, I already told you. Example, after surgery, the doctor forgot swab in the body of patient. I already told you. After surgery, doctor forgot swab or instrument in the patient body. That is a criminal negligence. Criminal, not Kabir Singh. Yes, criminal is a gross negligence. Here, if a doctor forgot the swab, a doctor forgot the instrument, doctor after drinking alcohol, doing operation, the patient died. You have to operate Ramlal, but you operated Shamlal. You have to remove right leg, but you removed left leg. है ना? ये सारे criminal negligence है ना बेटा? But in criminal, the burden of proof goes to the doctor, and civil, the burden of proof goes to the patient. For criminal, it is criminal court, yes, and 106 BNS comes in action. I already discussed this one. Okay. This is a very important one. A patient was referred by a doctor to a radiologist for a CT scan. The doctor was given money for this referral. Oh. Yes. Doctor was given money for the referral. It means doctor was given commission. This giving commission after splitting the fee of a patient, this is known as dichotomy. So splitting the fee of patient and giving commission, you are referring to some patient to someone and giving commission. That is dichotomy. D for dichotomy, D for आप दलाल बन चुके हो. You have become a dalal. You are not a doctor. You are referring and you are getting commission. That means you are a dalal, dichotomy. D for dalal, D for dichotomy. Is it clear, beta? Chalo. Sir, a alleged history of gunshot injury and there is a burning, blackening and tattooing around the wound. Says this is a wound and there is a blackening, burning and tattooing around the wound. What is this injury? All three are present. It is a close shot entry wound. It is a close shot entry wound. I will explain. Don't worry. But there are four ranges. Yes. What are these four ranges? Number one, contact shot. Number two, close shot. Number three, near shot. Number four, distant shot. Contact shot. Contact is a contact. So muzzle impression present in the contact shot because there is a contact of weapon. All remaining, बाकी सब में muzzle impression नहीं होता. In all remaining, muzzle impression is absent. Only in contact shot, muzzle impression is present. In contact shot, there will be a stellate shape or star shape. All remaining are circular shape. Yes. In contact, there will be more pressure. Stellate shape or star shape. All remaining, it's a circular shape. Now, sir, burning, blackening, and tattooing. I am coming to a very important point. Burning is caused by flame effect. Blackening is caused by smoke, and tattooing is caused by gunpowder. Burning is because of flame effect. Blackening is because of smoke effect, and tattooing is because of gunpowder. Here, surrounding the entry wound, it's a contact shot. Here, burning, blackening, and tattooing will be present, but inside the wound, inside the tissue. Surrounding the entry wound, burning, blackening, and tattooing will be absent. In close shot, as the question is depicting, burning, blackening, tattooing all present. In near shot, flame effect disappears, only burning, only blackening, tattooing, or only tattooing. Okay. And in distant shot, my dear friend, yes, in distant shot, it is all are absent. All are absent. Absolutely. So what are the questions you can get here? Stellate shape, contact shot, muzzle impression, contact shot, burning, blackening, and tattooing absent in contact. Close shot, burning, blackening, tattooing, all are present. Near, only blackening and tattooing or tattooing only. And my dear friend, distant shot, all are absent. All are absent. Now, sir, abrasion and grease color present in all wound. Yes. Yes, present in all these. Yes. Here also abrasion and grease color present in near and distant shot. Everywhere abrasion and grease color are present. These are the feature of entry. Is it clear? बेटा एक बार thumbs up दे दिया. चलो आगे. Done, sir. Sir, bullet fingerprint involve primary marking, secondary marking, both. Yes, my dear friend. Bullet fingerprint are primary marking as well as secondary marking, both. Bullet fingerprint are both type of marking. Okay, I'll explain. Primary marking. What is primary marking? Primary marking are marking because of rifling. What is rifling? What is rifling? That is a marking caused by land and groove. Marking caused by land and groove. So if a weapon is a rifling, and according to the rifling, there is a marking on the bullet, that is a primary marking. It is a class marking of the weapon, and it's a gross marking. It is rifling of the barrel. Because of that, there is a marking. That is a primary marking. Yes. Secondary marking are because of irregularity inside the barrel. It is individual marking. It is a microscopic marking. Secondary marking is a marking because of irregularity inside the barrel. Like if you fire, and there is the irregularity of the barrel produces marking. That is a secondary marking. That is a secondary marking, individual marking. It's a microscopic marking. But bullet fingerprint is primary as well as secondary, both. So many questions I'll ask, like because of the rifling, primary marking. Because of irregularity of the barrel, secondary marking. Which is a gross marking, primary marking. Which is a microscopic marking, secondary marking. Which is a bullet fingerprint, both. This is a simple explanation of two marking which can be asked in an exam. Okay. Now the patient was brought to the casualty with greenish color skin and rotten egg smell, my dear friend. This is very, very important question, my dear friend. It is hydrogen sulfide. And I'll give some smell, fruity smell in ethanol. A for acrid smell, A for paraldehyde. Yes, yes. A for acrid smell, A for paraldehyde. Rotten egg smell or sewer gas smell, H2S, hydrogen sulfide. Hydrogen sulfide. Rotten egg smell, this was the question. Neely fish, aniline, rotten fish smell. This is my favorite question, my dear friend. Organophosphate smell is kerosene smell. Yes. Fishy smell is zinc phosphide. Now you remember a very simple trick, BC. BC. Bitter almond smell, BC cyanide. Burnt off smell, cannabis, BC. Very simple trick to remember. Bitter almond smell in cyanide and burnt off smell in cannabis. Shoe, which shoe do you like most? आपको सबसे अच्छा कौन से shoe पसंद है? Nike. Very simple trick, nitrobenzene. Nitrobenzene. So this is a trick to remember. Shoe polish smell. You like Nike shoes, nitrobenzene. Bitter almond, BC, cyanide, burnt rope, cannabis. Kerosene smell is very important. Organophosphate. Garlic pizza, P for pizza, P for phosphorus. Garlic pizza in thali, thali for thallium and arsenic. Thallium and arsenic. So garlic pizza in thali, phosphorus, thallium and arsenic, that will be a garlic smell. That will be a garlic smell. Yes or no, my dear friend? Garlic pizza, P for phosphorus, thali, thallium. Garlic pizza में thali में पसंद है, और in garlic we have AR, arsenic. That is arsenic. P for. So these are some smell you can get in your exam. Now, antidote for benzodiazepine toxicity is fomepizole or flumazenil. Yes. Fomepizole or flumazenil. Give me the answer, anyone. Fomepizole or flumazenil? It is flumazenil. Yes, very important. Flumazenil. Now, sir, just remember, physostigmine is an antidote for one poison, that is datura. Physostigmine is an antidote of one poison, that is a datura. I'll discuss all remaining antidote. Don't worry. Flumazenil is for benzodiazepine. Zenil. Now, sir, for paracetamol, N-acetylcysteine, done, sir. Methanol, it is fomepizole or ethanol. Fomepizole and ethanol. Carbon monoxide, the antidote is oxygen. Benzodiazepine, it is flumazenil. Opium or any opium product, like sometimes you can get a question like, what is the antidote of heroin? Yes, you can get this question also. What is a antidote of heroin? The heroin antidote, because heroin is a opium product. Yes. So for opium, morphine, codeine, heroin, brown sugar, the antidote is naloxone. Organophosphate, it is atropine and oxime, like prilidoxime. Datura, I already told you, physostigmine. Cyanide, the best antidote is vitamin B12, but remaining antidote are amyl nitrite, yes, amyl nitrite, sodium nitrite, and sodium thiosulfate. This triple antidote is also known as Lilly antidote. Be careful, sir. Lilly antidote is a triple antidote. Lilly antidote is a triple antidote. Amyl nitrite, sodium nitrite, and sodium thiosulfate is Lilly antidote. In thali, we like pizza. For thallium, it's a Russian blue. For meth hemoglobinemia, it's a methylene blue. So these are some very important antidote can be asked in the exam. Paracetamol, it is N-acetylcysteine. Methanol, it's a fomepizole and ethanol. Carbon monoxide, it is oxygen. Benzodiazepine, flumazenil, opiate, naloxone, and heroin. Organophosphate, atropine, and oxime. Cyanide, vitamin B12 is the best antidote. Amyl nitrite, sodium nitrite, and sodium thiosulfate is a triple antidote. Thali mein pizza parso, Russian blue. Math hemoglobinemia, it is, yes, my dear friend, methylene blue. Beautiful question. Which of the following diagnosis is for given hematological picture? If you see the RBC having blue dot, tell me, what is your answer? Minamata disease, Saturnism, chronic iron toxicity, arsenic poisoning. Tell me, dear. Yes, it is B. It is, my dear friend, none other than plumbism or Saturnism. It's a lead poisoning. Here you can see the blue dot in RBC, that is known as basophilic stippling. Minamata disease is caused by mercury. Yes. Iron toxicity is not the feature. And arsenic poisoning, we have the Mies line. Arsenic poisoning, we have the Mies line. So Minamata disease is caused by mercury. It's lead poisoning, basophilic stippling. Chronic iron toxicity is not there. And arsenic poisoning, there is Mies line. You can see A for arsenic, A for Eldridge Mies line on the nail. Yes. But sir, just remember, Eldridge Mies line are also seen in thallium poisoning also. So be careful, thallium poisoning also. AR arsenic, R for red velvety mucosa, AR. R for raindrop pigmentation. R for raindrop pigmentation. Arsenic. If I pick the I word for arsenic, A is done, Eldritch means line, R for raindrop pigmentation. I is the iron is an antidote for arsenic. Antidote is iron, that's a ferric oxide. And C, arsenic mimics a disease that is none other than cholera. Arsenic mimics a disease that is a cholera. Arsenic mimics a disease that's a cholera. But which arsenic? Chronic arsenic or acute arsenic? Acute arsenic poisoning mimics a cholera. So these are the questions you can get regarding some arsenic poisoning, Eldritch means line, red velvety mucosa. It is red velvety mucosa, raindrop pigmentation, iron is an antidote. But sir, what is the chelating agent? Chelating agent for arsenic is BAL, which is also known as dimercaprol. The chelating agent of a arsenic is a BAL, British antilucide, which is also known as dimercaprol. Dimercaprol. So that's a very important few question of the arsenic poisoning you can get in exam. Identify the plant, anyone? Tell me, this is a cardiac poison. Identify the plant. Cerebrathivacia, Ricinus caminus, Datura, Papaver somniferum. Anyone? Give me the answer. It is A. It is Cerebrathivacia, which is a yellow oleander. It is a Cerebrathivacia, which is a yellow oleander, Pila Kaner. The toxin are cerebrine and theotoxin. Cerebrine or theotoxin. This is a cardiac poison. This is a cardiac poison. It attacks on the heart. That's a cardiac poison. Yes, nerium is a pink oleander. Nerium is a pink oleander. Okay. Now, sir, this is a poppy fruit, a theme. It causes pinpoint pupil, coma, and respiratory depression. So you can get a picture. This is opium or poppy fruit. And here we get the aphene, and here vertical incisions are given. What is the D option? What is the D option? Papaver somniferum is beta opium. Papaver somniferum is an opium plant beta. Papaver somniferum. Shivaji, Papaver somniferum is the opium. Okay. Chalo. So this is opium, aphene or poppy fruit. Papaver somniferum. This is Papaver somniferum. Is it clear beta? Chalo. This is Datura. Datura stramonium. Yes, these are Datura seed. It is an anticholinergic plant and the fetal dose are 100 seeds. Fetal dose are 100 seed. The main toxin is hyoscine and it is a delirium poison, my dear friend. It causes delirium. It causes delirium. It causes delirium. That's why it is used as a railway roadside poison. And the antidote for Datura, I already told you, it is physostigmine. The antidote for Datura is physostigmine. The main active principle is not atropine. It is hyoscine. It is a hyoscine. Thorn apple or Datura stramonium. Thorn apple or Datura stramonium. A railway roadside poison. Railway roadside poison. How many seeds are fetal dose? 100 seeds. The main anticholinergic principle is hyoscine, not atropine. Now, sir, this is Ricinus communis RND. 10 seed are the fetal dose castor plant. And it is an organic irritant plant. Ricinus communis, castor plant and RND plant. It is a organic irritant plant. The fetal dose is 10 seeds. Now, sir, anyone who can tell me this one, a 28-year-old male is brought to the emergency on examination. His PR is 50, BP is 80-60, RR is 7, temperature is 95, pinpoint pupil and disoriented. Yes, this is opioid intoxication. You can see these are the feature. You can remember by opium type morphine. M for meiosis, O for orthostatic hypotension, R for respiratory depression. Yes. P for it causes pain relief, H for histamine release, which causes bronchospasm and hypothermia. Very important point. Hypothermia. Yes. I for increase intracranial tension and infrequency of urine. N for nausea and naloxone is an antidote. I already discussed. E for it causes euphoria and S for sedation. So these are the feature of opium intoxication. Meiosis is there. Respiratory depression is there. Orthostatic hypotension is there. Hypothermia is there. Sedation and euphoria is there. This is opium intoxication. What are the withdrawal effect, beta? Yawning, insomnia, dysphoric mood, dehydration. The opposite. Increased BP, heart rate, respiration, secretion, piloerection, and mydriasis. Two important features are piloerection and mydriasis are also very, very important feature, but this is opium intoxication and opium withdrawal. These are opium withdrawal effect. Opium withdrawal effect. And please be careful about the cocaine effect. Cocaine is a sympathomimetic, so heart rate, BP, and respiratory rate all will be increased because cocaine is sympathomimetic. These are opium intoxication, yes, and these are opium withdrawal effect. A person comes to OPD with a burn injury to the right thigh on examination. There is a sodening along with erythema, blister, and line of demarcation, then extend down to the limb. What is the most likely cause of the injury? Electric burn, chemical burn, dry heat, and moist heat. Give me the answer. It is a moist heat which is scald. When the moist heat more than 60 degrees, there is a formation of scald. Now, how did you identify moist heat? First one word is sodening. That is sodening. Then erythema, blister, and line of demarcation present. That is going down because moist heat goes down to the contact. So it is sodening is a catchy word and going down is a very important word. That's a moist heat. What is a scald? Scald is moist heat injury. Scald is moist heat injury more than 60 degrees centigrade. Like liquid or steam more than 60 degrees centigrade is a scald. Now, come to the difference, beta. Sir, there are three injury: dry burn, moist burn, and chemical or corrosive burn. See, if you see tinging and blackening over the skin, that's a dry burn. You can see this is a dry burn. The blackening of the skin, singeing of the skin is there. But in moist burn and in chemical burn, both are absent. Sodening present in moist burn mostly. In chemical and corrosive burn may be present, may be absent. Blister present in dry burn and moist burn both, but blister are absent in chemical burn. That is the reason, my dear friend. It was not a chemical burn. Here blister present. Here blister present. Red line present in dry burn and moist burn both, but red line absent in chemical burn. Be careful, my dear friend. Blister and red line both absent in chemical or corrosive burn. Sodening present in moist burn, but sodening may be present in chemical and corrosive burn. And singeing and blackening only present in dry burn. That's a flame burn. Now you can see this is a moist burn. Is this table clear, beta? Give me thumbs up. Very important table this is. Is this table clear, beta? Very important table this one. Singeing and blackening, dry burn, flame. Yes. Sodening present in moist burn, sometime in chemical burn. But blister and red line both are absent in chemical burn. This is very important. Now, sir, a patient died and the patient died and relative said he had a tattoo, but on autopsy, no tattoo mark was seen. What is the best location to check if he had tattoo? The tattoo dye can be seen in the lymph node level, beta, and we can go for a biopsy that is known as regional lymph node biopsy. That is the way we can get the tattoo location in the biopsy done is regional lymph node biopsy. So here answer is C. Yes. Which of the following is the true about the cause of the given finding? Tell me, dear. Lightning strike, electrocution, marbling, and trickling down of the acid. It is A, lightning strike. It is A, lightning strike. You can see lightning fall on your body. Lightning fall on your body. F for filigree burn, A for arborescent burn, and L for lichenber burn. Bijli ki kiran giri fall. And what giri? Kiran. That is a keranographic burn. F for filigree burn, A for arborescent burn, L for lichenber, Kiran for keranographic burn. Sir, but it never corresponds to the vascular channel. It never corresponds to the vascular channel. It is pink color erythematous, and just keep it in your mind that yes, it is denaturation of the RBC. Aparna is absolutely right. It is due to denaturation of the RBC. And air compression in the lightning goes in always in front. Lightning is behind, air compression in front. It is a pink erythematous marking. It doesn't correspond to the vascular channel. So lightning fall as a kiran. This is a lightning burn. Bijli ki fall kiran. Kiran fall hui. That's a very important. Now, sir, a very, very important question. A dead body of a 20-year-old male was found in the sea, was brought for the postmortem examination. C. The main catchy point is C. Which of the following finding indicate it's a seawater drowning? Tell me. Hyponatremia, hyponatremia, hyperkalemia, myocardial infarction, hemodilution. 1 and 3, 1 and 4, 2, 3 and 5, and 2, 4 and 5. Yes, it is 1 and 4. I'll explain this. Don't worry. Okay? I'll explain it. So there are two types of drowning. That is a freshwater drowning and seawater drowning. Freshwater drowning and seawater drowning. C. If the fresh water, this is your pulmonary capillary. If your fresh water come in the blood vessels, that will cause hemodilution. Yes, that will cause hemodilution. But if the seawater, listen, my dear friend, if the seawater comes in the pulmonary capillaries, that already has these all things, yes, sodium chloride, magnesium, strontium, that will cause hemoconcentration. Hemoconcentration. Yes, listen. Now, hemodilution, so there will be hyponatremia in freshwater drowning. To neutralize hemodilution, my dear friend, to neutralize hemodilution, RBC releases potassium ion. So that will cause hyperkalemia. So hemodilution leads hyponatremia, RBC. This RBC releases potassium ion that will cause hyperkalemia. And hyperkalemia causes ventricular fibrillation. You will die in 4 to 5 minutes. That's a beauty. Hyperkalemia causes ventricular fibrillation and you will die in 4 to 5 minutes. This is freshwater drowning. Now, in seawater, there's already a sodium. Yes, my dear friend. That will cause, yes, that will cause hypernatremia. That will cause hypernatremia. Potassium is normal. This hypernatremia causes bradycardia and you will die in 8 to 10 minutes. You will die in 8 to 10 minutes. This is very important. So just concentrate. Freshwater drowning, hemodilution. Seawater drowning, hemoconcentration. Freshwater drowning, hyponatremia. Seawater drowning, hypernatremia. Freshwater drowning, hyperkalemia. Seawater drowning, potassium normal. Freshwater drowning, hyperkalemia causes ventricular fibrillation, death in 4 to 5 minutes. And seawater drowning, hypernatremia causes bradycardia and death in 8 to 10 minutes. So this is a very, very important. And in both drowning, because both are wet drowning, the cause of death is cardiac arrest. One is due to ventricular fibrillation, another due to bradycardia. I think you got this very important table in your mind. Is it clear, beta? This was all about a very important high yield topic session, concise and precise topic, my dear friend. I tried to cover everything, even every option I discussed in detail. This was a very, very important session for your examination point of view. Thank you very much, my dear friends. Wish you best of luck for your exams. आप हमेशा खुश रहो, टेंशन मत लो, रिलैक्स रहो, अच्छी तरीके से पढ़ाई करो, भगवान आप सबका भला करे। तो गॉड ब्लेस यू ऑल, बाय बाय, टेक केयर। पढ़ाई करते रहो, मेहनत करते रहो, फिर मिलते हैं। बाय, टेक केयर।